Hi, everybody. Dr. Dave here. Wanted to tackle a problem that comes up in pediatrics quite frequently, one of the bigger concerns that parents have when they have a newborn young infant, and that is the crying infant. Now, this is actually almost as hard for the pediatrician sometimes as it is for the parents. And trying to give guidance and reassurance in these situations, as well as good advice as to when to be concerned about excessive crying, is very difficult. It's one of the more challenging encounters in pediatric medicine. And of course, it's something that creates a lot of anxiety and stress for parents. Now, when we talk about colic, the colic infant, we're really talking about younger infants. This is under 3 or 4 months of age for the most part, also older than about 2 or 3 weeks of age. If you have a newborn that is displaying colicky crying spells, it's probably not okay, or at least it should be investigated. It could be okay, but it should be investigated. And if you're talking about kiddos who are getting up into the second half of the first year of life and they're having these kind of excessive crying episodes, that should be investigated too. But the biggest question I get is, how do I know that this is okay? He's crying, he won't stop, there's nothing I can do. And there are some real basic hints here. First of all, if the child is showing any signs of illness, fever, vomiting, not wetting diapers, not feeding enough to wet diapers, you've got diarrhea, significant cough, any of those things going on, we need to assume that it's not just colicky crying. Of course, if the child's not growing and developing properly, we're missing milestones, we're not staying up on the growth curve, all of those things have to raise some degree of alarm as well. The classic colicky child is 3 to 4 weeks of age, about where it starts, peaks about 8 to 12, usually gone by about 16 weeks, if not sooner. Intermittent periods of prolonged explosive crying, very difficult to console. The classic colicky patient starts in the late afternoon, early evening, and most of the time, these episodes, again, they tend to burn out on their own over time, usually by 3 or 4 months of age. We don't have a lot of good data to tell us what makes this better. Nobody's even really truly figured out what it is. We just know a lot of kids do it. If the physical exam is normal, and again, always good to bring these children in and have a pediatrician look at them and make sure everything's okay, make sure there's nothing going on with the exam, make sure they're growing and developing normally. But if they don't show any of the warning signs of illness, they're growing and developing okay, feeding, wetting diapers, and physical exam's good, then they were probably dealing with a classic colic episode. The technical definition of colic is more than 3 hours of sustained crying, more than 3 days a week for more than 3 consecutive weeks. I joke that by the time they meet that definition, they've outgrown it. I define it as repetitive, prolonged periods of crying causing distress to the infant and family. And the old wives' tales, the old mom's tales, grandma tales, they tend to work. Motion helps. I had a friend in training who put his child in the car seat and he would just drive 45 minutes north and 45 minutes south on the interstate, and that seemed to help. Turning on something that creates some degree of white noise, a running vacuum cleaner, static on a radio, although I don't know who's listening to broadcast radio that much anymore. I've even had parents put a car seat on top of a running dryer for the vibration. In the end, motion seems to help. There was an interesting study done out of Japan just recently. It only looked at 21 infants in Japan and Italy, and they ranged from newborn to 7 months of age. So how easy this is to interpret to daily life is hard to say, but they found that continuous motion, holding the child and walking in continuous motion for more than about 5 minutes or so, followed by sitting down with the child and holding them for another 5 to 8 minutes after the child became sleepy or calm, and then trying to lay the baby down seemed to be the easiest way to get the child calm and back to sleep if this occurs in a sleeping period. But whatever seems to work will help. I know that sounds simple, but most families find that there's a handful of things they can do to make this better. And if you've found that for your child, do that. If you need to go in to see your pediatrician frequently in this time frame just for peace of mind and reassurance, do that. If your child is showing any of the warning signs I talked about, definitely take them in as soon as possible. But the good news here is that this does go away on its own. The child does outgrow it. There is no evidence that a colicky child in infancy is a more difficult toddler, preschooler, teenager, has no bearing on their future behavior. You're not failing as a parent. A lot of parents go through this. The best parents in the world have trouble with this. It is difficult. Use your resources. Use people in your life to give you a break, because it's hard for you to console your child if you are stressed. And your pediatrician is always there for you. And if he or she isn't, maybe it's time for a new one. But in the end, this will get better. It will be okay. I hope that helps. Have a great day.